My PhD was looking at the association between sanitation quality and coverage with fecal contamination of the household environment and diarrheal disease among children under 5 years of age in Bangladesh. My data shows that sanitation infrastructure cannot explain variation in level of fecal contamination in the household environment. However, the issues related to maintenance of the sanitation facility can explain the variation in the level of fecal contamination in the household environment. Particularly in our study area, we found that households that were using private improved sanitation facilities had lower level of fecal contamination in the toy bowl we used to measure fecal contamination compared to the households that used shared but improved sanitation facilities. We also found that the shared facilities were more likely to be dirty. So it suggests that probably that shared facilities can have adverse health outcome via cleanliness of latrine, but there may be other issues like maintenance of the toilet facilities. Also we can understand that shared facilities, there will be more user of shared facilities. That means that the shared facilities would be full quickly, and that means that there will be more maintenance required. I think now that we are from the MDGs, we are now moving towards the Sustainable Development Goals, and there has been a lot of discussion about whether to include shared sanitation or not. So I think my study findings suggest that we should still consider shared sanitation facilities as unimproved unless we have some data which shows that in that particular situation shared sanitation is safe. I think I'm proud of the fact that this was a study which I thought it would be challenging to do, and I didn't have experience in doing microbiology, but I think I finished it up, and it seems like that this data is going to be helpful in terms of making decision about what type of intervention should be targeted, particularly in the context of Bangladesh, where in the rural areas people are mostly related to each other and is still using a shared facility, and my data suggests that even if they are related, then they know each other, they can still have issues with cleanliness of the toilet and maintenance of shared facilities. I felt like the most important part was that because of shared funding, I think 5 or 6 of us started our PhD together. And although I have been hearing that when you're doing a PhD you're on your own, but I felt like having the group helped us a lot, and I think we learned from each other a lot. I think that part was really helpful. At least going through the stressful time, we had someone, but also we studied together as groups, and whenever there was a confusion, I think we could talk to each other. I think that was really helpful. But the other important part was also like having access to all the share research experts here in the school. I think because of being shared student, we had more access to everybody, and nobody could say no, and somehow people are very friendly. So I think that also helped us a lot. And because my study involved like microbiology, but epidemiology, but also knowing share. So I had to go to different people, and somehow everybody was so helpful, and I think it's because of the platform I got from the share. I am working at ICDTRB as an assistant scientist, and we have started, I'll be looking at 2 projects. One project is looking at integrating water sanitation hygiene with child and maternal nutrition, and also child stimulation. So it's really combining wash with nutrition and child development. So I think this is going to be a great study, and I'm looking forward to it. I feel like we should focus our research interest towards looking at the unfinished business in terms of so we know that we need to make toilets, but there are still a lot of issues in terms of child feces disposal. Like that's an area that is that we need to pay more. We need to do more research, but also we need to do more programs that is targeting specifically on child feces disposal, and also in terms of I think with my experience in Bangladesh, I think particularly for the urban areas, I think child feces disposal has to be given more attention. But also I think it seems like given that the rate of diarrheal disease is becoming less and less, and diarrheal disease may not be a suitable indicator. So we should probably think beyond diarrheal disease. I think we should attempt to look at nutritional outcome